Hello, everyone, and welcome back to the podcast. We are recording live here at Vive in Los Angeles, and today I have the privilege of hosting Marc Zemel. He is the CEO of Retia Medical. Marc, welcome to the podcast.
Yeah, well, thank you so much for having me, Saul.
It's a pleasure. It's a pleasure. Let's kick it off with sharing a little bit about you, your background, and tell us more about Retia and the big problem that you believe the industry is.
Sure, thanks. So I started my career, I trained as a mechanical engineer, got my master's from MIT, and then I worked in the semiconductor capital equipment industry. I loved it. I loved the precision of getting in there and measuring things down to the nanometer level. And then about 9 years into my career, I got the call that nobody wants. My father had died of sudden cardiac arrest. He was on a biking trip in Nova Scotia.
Oh, wow.
It was awful.
Wow.
And when something like that happens, you take a look at yourself and you say, what am I doing with my life? How am I making an impact? There's only a finite period of time. What am I doing to contribute to society? So that was the question I asked. And the other question was, how come I knew so much more about what's going on with a piece of silicon, right, in real time than we did about my dad, right? So I decided to switch into medtech. And so I got my MBA from Yale, and then worked at Becton Dickinson for a couple of years, which was a fantastic introduction, to the medtech space. And then decided to start Retia to really go after that mission of understanding what's going on in the cardiovascular system, so that we could detect problems before they are, unrecoverable, right?
Totally. And when did you start Retia? How long ago?
It'll be 15 years in May.
Years. Awesome.
Yeah.
Well, I do want to say, Marc, congratulations on the recent FDA approval of Argos Infinity. For the folks that don't know what Argos Infinity is, I'd love if you could just share a little bit about that and what that means for the industry.
Sure. So 7 years ago, we came out with the Argos cardiac output monitor for advanced hemodynamics, which monitors cardiac and circulatory function. That's in 75 hospitals right now, and in the US it's sold by Medtronic. And about 2 years ago, I was sitting with the head of the e-hospital at Cleveland Clinic. That's their tele-ICU platform. And I said, we really don't need a box at the bedside. We just need the data that you guys are already collecting. What if we put our algorithm in a virtual server in your platform and monitored every bed in a massively parallel way? And they said, yes, please, right? So we did it, and they were awesome. We built the software to their specs, and they helped us under IRB to test it. And then just, as you said, about a week and a half ago, we got FDA clearance for our first software as a medical device.
Well, congratulations on that. That's huge. From this idea, in an EICU at Cleveland Clinic to now a reality. How does it feel to finally have it?
It's amazing. It's one thing to have the vision. Lots of people have ideas, but what I'm most proud about is the team that executed to that vision and made it a reality. Not just our internal team, the engineers, regulatory, quality, all those folks, but also the partnership with Cleveland Clinic. They were fantastic throughout that process. We also worked with Airstrip, who helped build that sort of middleware interface so that we could get the data that we need. So it's the thing that I love about software. It's not just somebody working in isolation. It's this idea of collaborating with multiple organizations to make the vision a reality.
I think that's awesome, Marc. Congratulations on that. What do you think is broken in traditional cardiovascular monitoring that most people don't see?
It's just not always there. When we look at these devices, monitoring and data has been in these silos, and it's sort of like this rationing of data. Data should be ubiquitous. And what do we see? We see expensive capital with expensive disposables, which is a great 20th century business model, the razor blade. But the consequence is that it's like, okay, do we put it on this patient? Do we not? Do we want to spend this money or do we not? And unless you're the amazing Kreskin or somebody who can tell, you're always guessing. And so historically, monitoring has been one about productivity or sort of an ad hoc decision making around, do we monitor this patient more carefully or not? And our view is you should have the data available no matter what the patient is, because that's somebody's grandmother, or grandfather, or father, right? And so then it's about making it reliable across all those patient populations, all those conditions, right? Without having to thread a catheter through your heart to get that information. Those are all the things that we set out to fix when we started Retia.
That's great. And you know, you took us back to the fine-tuned measurements of the silicone real time. And why can't this be available? So you made it available in a box. And then you're like, you know what? Why can't this be available beyond the box?
That's right.
And now it is.
That's it. And I'm just so excited about where we can take this because when we show it to our clinical advisors, they're like, we need this, right? We need it in non-invasive. I'll give you an example. So one of our advisors is a major academic medical center, and he said 70% of sepsis is diagnosed in that facility via head CT. And I'm looking at like, what do you mean? Like we're like cross-eyed or something? And he said, yeah, because they're in the bed and they suddenly have altered mental status. And so then they run their stroke protocol and they've got to get a head CT because, you know, there's that golden hour. Well, it turned out they were vasodilating, and if they had had our technology, they would have known, okay, this guy's going septic, you know, eliminates that whole inefficient and costly workflow. And by the way, the earlier treatment matters in sepsis too. So all that delay matters. So these are the inefficiencies that we're trying to, you know, systematically take out of the system through better insights.
Yeah. So then when the thing happened to your dad, he was admitted into the hospital?
No, he died on the road. I mean, he was in the middle of Nova Scotia and, you know, up the first hill and then 45 minutes for the ambulance, you know, no time.
Yeah.
But, you know, everybody has a wearable now, right? Like, you know, who knows whether we would have been able to predict. But I will tell you, you know, we were talking with Mayo Clinic and they're like, well, cardiogenic shock, right? Heart attacks. There are a lot of them, there's signs 24, 48 hours ahead of time that person is starting to decline.
Oh, yeah.
Absolutely, right? And they don't catch them early enough. And that doesn't just lead to poor outcome, you know, but it also is missed opportunities, right? Missed opportunities for valves or implants or all these procedures that if they are performed in a timely fashion, right? That we talk, again, it's like time is tissue, right? If we can pick up those things earlier, that's not just negating a negative, it's also, and let's be practical, it's a revenue opportunity for the hospital, right? That surgery is gonna help make that hospital more money, which is then allowing them to then, you know, deliver better care in a sustainable way for more patients.
Totally. No, that's great. And you know, today's environment, Mark, is really, especially for hospitals, right? There's intense financial pressures. Everything's changing. What has changed in healthcare overall that makes what you offer and what your team offer more relevant than ever?
Yeah, well, this has been a steady evolution over the past 10 years. It accelerated with COVID, and what we saw in COVID is we can't make experienced doctors and nurses fast enough, right? And so we have that on one side, and then on the other side, we have patients showing up at the hospital older, sicker, with more comorbidities, right? And that's not changing. So, you know, we look at demographics. I was in Japan last year, and 42% of cardiovascular surgeons are working more than 60 hours a limit, which if you think about airplane pilots, their flying time limit, they have that for surgeons too, right? Because that's where the errors happen, right? So it's the same issue where we need better technology to help prevent those complications, those preventable harms. And this year we're tracking hospital harms like acute kidney injury, which is, kidney is like the canary in the coal mine when it comes to not getting enough blood flow, you know, to keep the organs alive, right? And so that's a hospital harm this year. Next year it's going to affect reimbursement. So as a society, we realize we have to do better. And so there's a carrot and a stick happening, you know, in the marketplace. That means we need better and better ways to get the insights sooner.
Yeah, well said, Mark. And so I guess, you know, viewing this approach to cardiovascular monitoring, are you looking at it as better monitoring, or are you redefining the category?
Yeah, we're not just making a better box, right? We're moving past that. What we're trying to do is create what I would call distributed cardiovascular intelligence. So it doesn't matter whether you're in a single hospital bed or anywhere in the system, you have access to that data, or even at home, right? You could be on the other side of the state monitoring somebody, or you could monitor it yourself, right? And these things are going to start to pick up problems and tell you, okay, maybe you need to get that checked out, right? So we're trying to create a category where we're no longer tied to that site of care. We're bringing that data to you no matter where you are.
Well, I think that's fantastic. And if you were to say, if Retia is to succeed at this, what will people say you created? What's that category?
I call it distributed cardiovascular intelligence. But when I think about what success means, it's about that guy who had sepsis, who left the hospital, walked out, right?
Yeah.
Not through the other end, through the morgue,
Yeah.
right? That's how we measure success.
That's great, Mark. Well, look, I want to just congratulate you again on the latest FDA approvals, all the hard work that you and your team are doing, the work that you guys are doing through Medtronic as well. Like, you guys are doing such great things. If anybody out there is looking for this type of solution, where can they reach you and where can they reach the company?
Well, go to our website, www.retia.ai. That's RETIA. I'm on there. You can find me. It's pretty easy. We're a small company, but we're making lots of impact, and love to talk to anybody who wants to help us on this journey.
That's great, Mark. Thank you very much. And for everybody with us, thanks for tuning in to another episode here of the podcast. Marc Zemel, CEO of Retia Medical. Make sure you check out the show notes for all the ways to get in touch with him and his team. Thank you all for tuning in. And Mark, thanks for being with us.
Yeah, pleasure. Thanks all.